Good morning, everybody. My respected teachers and respected faculty members, my senior colleagues, and my junior colleagues. My topic is renal function test by Dr. Anjan Mukherjee, second year PGT of Burdwan Medical College and Hospital, Department of Physiology. Now, this is the structure of the kidney. Here, the kidneys are attached to the bladder by ureter, and urine is excreted through urethra. Though it is a very simple diagram, but it has very important implication in my topic. This is the functional unit of the kidney, that is nephron. Here we see the different parts of nephron. Now, what is the purpose? To diagnose the disease or the disorder of the kidney and urinary tract and other systemic disease that affect the kidney functioning. Number 2, urine examination is usually employed to diagnose the most of the kidney disorders. Urine examination is classified into 3 types. First, macroscopic examination, second, microscopic examination, third, chemical examination. Now, what is the utility? To assess the functional capacity of the kidney, the early detection of possible renal impairment, severity and progression of the impairment, monitor response to the treatment, monitor the safe and effective use of the data excreted in the urine. When we should perform? Older age, family history of chronic kidney disease, decreased renal mass, low birth weight, diabetes mellitus, hypertension, autoimmune disease, systemic infection, urinary tract infection, nephrolithiasis, obstruction to lower urinary tract, and drug toxicity. What we examine? We examine the urine analysis, blood examination, glomerular function test, and tubular function test. Now, the function of the kidney: formation of the urine as a waste product, excretion of NPN substance such as urea, creatinine, and uric acid, regulation of water, electrolyte and acid base balance, and production of hormone, that is erythropoietin, renin, and calcium. Urine examination by means of physical examination, chemical examination, and microscopic examination. Assessment of glomerular function is renal clearance test, blood analysis of urea and creatinine, proteinuria, and hematuria. To test the measure renal plasma flow by para-amino hippuric acid test. To assess the test for assessment of tubular function by urine concentration test, urine dilution test, specific proteinuria or tubular proteinuria, amino aciduria, and PSP test, and renal biopsy to confirm the diagnosis and renal diseases. This picture clearly says that how urine analysis is done. First, by physical examination that include volume, color, odor, reaction or pH, and the specific cavity. Second is the biochemical examination that includes protein, sugar, ketone body, bile salt, bile pigment, blood. And third is microscopic test that include cells, crystal, cast, microorganism, parasite, contaminations. Macroscopic examination include color, odor, pH, specific cavity, and the volume. In this figure, the normal urine volumes are displayed. Urine analysis. Urine examination is an extremely valuable and most easily performed test for the evaluation of renal functions. It includes physical or macroscopic examination, chemical examination, microscopic examination of the sediment. Now, the color, normal color is pale yellow due to urochrome, abnormal color observed during disease state, red such as red color seen in hematuria, beetroot juice intake, blue color seen in cholera, yellow brown bilirubin or yellow green biliverdin color seen in jaundice, orange color seen in excessive sweet intake in case of fever, and black color is melanoid. Odor, it is slightly pungent. Various other smells are observed in different conditions. Aromatic smell found in volatile fatty acid. Ammonical smell due to bacterial action. Fruitis odor due to ketonuria. Normal volume 1000 to 2000 per 24 hours depending upon the water intake. If there is increased urine level, that is called polyuria, that is more than 2000 ml. It may be due to certain drugs, IV solution, diabetes mellitus, etc. Decrease in urine level more than 400 ml per hour, that is called oliguria, and anuria, it is 100 ml of urine in 24 hours. This condition may be due to dehydration, congestive heart failure, due to renal tract obstruction, etc. Now the pH. Normal pH is 6, but it may vary from 5 to 9 depending upon the diet. High pH, that is classic renal alkalosis due to sodium carbonate containing drugs, teach vegetarians. Lower pH, classic renal acidosis due to starvation, ketoacidosis, fever, diabetes. Specific gravity, normal specific gravity 1.001 to 1.40. Increased specific gravity seen due to dehydration, fever, vomiting, diarrhea, congestive cardiac failure, diabetes mellitus. Decreased specific gravity seen is diabetes insipidus. Now come into the chemical examination. Test for protein, sugar, ketone body, bile acid and bile pigment and blood. For protein, we test sulfosalic acid test. Here it is clearly seen. Next, what is proteinuria? Presence of protein in urine, and various causes are seen due to severe exercise, high protein diet, pregnancy, kidney disease, damage to lower urinary tract and fasting. Sugar test, Benedict reagent test done. Here you also see presence of glucose in urine plus glucosuria. This may be due to diabetes mellitus, hypertension, corticosteroid drug intake, etc. Ketone bodies, Rothera's test is done. Presence of ketone body is called ketonuria. It may be due to starvation, excessive fatty acid metabolism and pregnancy. Bile test, sulfur powder test done. Presence of bile acid in urine may be due to jaundice, obstruction to biliary duct and liver diseases. Bile pigment, here you see two tests are done, and apart from this Benedict reaction also important. Presence of bile acids in urine may be due to jaundice, it is hemolytic or obstructive, obstruction to biliary tract and liver diseases. Blood benzene test is done. Presence of blood in urine is called hematuria. The causes of hematuria is renal calculi, glomerulonephritis, severe UTI, renal tract injury. Now come to microscopic examination. It is the analysis is done very simply by pouring the urine sample into the test tube and centrifuge it for 5 minutes. The top liquid part is discarded and the sediment left in the bottom is mixed with 1 drop of urine and is studied under the microscope to see the cells, crystal, cast, microorganism, parasite. Cells, few epithelial cells and RBC are observed occasionally in urine. It may be due to fever or urinary tract calculi or acute renal damage or glomerular nephritis. Crystal. Variable crystals are found in acidic urine like uric acid crystal, calcium oxalate crystal, cysteine crystal, etc. In the figure, you see the different types of crystals. Cast. Urinary cast are cylindrical structure produced by the kidney and present the urine in the convoluted tubule and collecting duct of electrons. Then dislodges and pass into the urine when they can be detected in microscopy. The cast are of two types, and cellular cast and acellular cast. The cellular cast are RBC, WBC and epithelial cells. And acellular cast are hyaline cast, fatty cast, waxy cast and pigment cast. In this diagram, you clearly see how the different casts are formed in different types of renal disease. Now the blood examination. Why we perform the blood examination? We perform blood examination to measure the substance in the blood that is normally excreted by the kidney. Their level in the blood increase in kidney dysfunction. As a marker of renal function, creatinine, urea, uric acid and electrolyte are done for routine analysis. NPN constituent of urine. NPN stand for non-protein nitrogen compounds. The nitrogen content of substance other than protein in the blood tissue and the waste product, and they are urea, uric acid, creatine and polypeptide. Clinically significant NPN constitute along with the approximate plasma concentration are listed below. Urea 45%, amino acid 20%, uric acid 20%, creatinine 5%, creatine 2% and ammonia 0.2%. Urea. BUN stand for blood urea nitrogen. Urea is a nitrogen. Urea nitrogen is formed when protein breaks down. A test can be done to measure the amount of the urea nitrogen in the blood. The blood test is often done to check the kidney function. Normal result is generally 6 to 20 mg per dl. Higher than normal level, azotemia may be due to congestive heart failure, excessive protein intake in the gastrointestinal tract, gastrointestinal bleeding, hypovolemia, heart attack, kidney disease including glomerular nephritis, pyelonephritis, acute tubular necrosis, kidney failure, shock and urinary tract obstruction. Lower than normal level may be seen due to liver failure, low protein diet, malnutrition and over hydration. Estimation of urea can be done by this. Here this is clearly displayed. Serum creatinine. Creatinine is the breakdown product of creatine phosphate in the muscle and usually produced at a fairly constant rate by the body depending on the muscle mass. Creatinine is filtered, not reabsorbed from the kidney. Normal range is 0.8 to 1.3 milligram per deciliter in male and 0.6 to 1 milligram per deciliter in female. Not increase above normal unit. GFR is less than 50 ml per minute. This method is widely used for serum creatinine are based of the Jeffreys reaction. Creatinine. A creatinine test reveals the important information about our kidney. Creatinine is the chemical waste product that is produced in our muscle metabolism and to a smaller extent by eating meat. Healthy kidneys filtered creatinine and other waste products from our blood. The filtered waste product leave our body in our urine. If our kidneys are not functioning properly, an increased level of creatinine may accumulate in our blood. A serum creatinine test measured the level of creatinine in our blood and give us an estimate how well our kidney is filtering, that is GFR, that is glomerular filtration rate. A creatinine urine test can measure creatinine in our urine. Normal range of creatinine is 0.6 to 1.3 milligram per deciliter. Increased creatinine level in the blood that suggests disease or the condition that affect the kidney function, and they are include damage or swelling of the blood vessel in the kidneys, that is glomerulonephritis caused by, for example, infection or autoimmune diseases, bacterial infection of the kidney, pyelonephritis, death of the cell in the kidney, the small tube, acute tubular necrosis caused by, for example, drugs or toxin, prostate disease, kidney stone, and other causes of urinary tract obstruction, reduce blood flow to the kidney due to shock, dehydration, congestive heart failure, atherosclerosis, or complication of diabetes. Creatinine blood level can also increase temporarily as a result of muscle injury and are generally slightly lower during pregnancy. Low blood level of creatinine are not common, but they are also not usually a cause of concern. They can be seen in the condition result is decreased muscle mass. Estimation of uric acid. Following method are measured: the chemical method and the enzymatic method. Principle of determination of uric acid by UBS test. Uric acid in the presence of uric acid enzyme converted to allantoin and H2O2, then 4-amino phenazole is converted to quinoid pigment in the presence of H2O2 and enzyme peroxidase. Greater than normal value of uric acid, hyperuricemia may be due to acidosis, alcohol intake or alcoholism, chemotherapy related side effect, diabetes, excessive exercise, gout, hypoparathyroidism, lead poisoning, leukemia, medullary cystic kidney disease, nephrolithiasis, polycythemia vera, urine rich diet, renal failure, and toxemia of pregnancy. Lower normal levels seen in pancreas disease, low urine diet, syndrome of inappropriate antidiuretic hormone CHART secretion, and Wilson disease. Glomerular function test. The GFR is the best measure of glomerular function. Normal GFR is 125 ml per minute. When it decreases to 30% of the normal, moderate renal insufficiency present. Patient remain asymptomatic with only biochemical evidence of the time of GFR. As GFR decreases further, severe renal insufficiency characterized by profound clinical manifestation of uremia and biochemical abnormalities such as acidemia, volume overload, and neurologic, cardiac, and respiratory manifestation. When GFR is 5 to 10% of normal, that occurs in end-stage renal disease. Here we see the clearance using inulin. Cin is equal to UIN into V by PIN ml per minute, where Cin stand for inulin clearance in ml per minute, UIN inulin concentration in milligram per 1 ml of urine, V volume of urine in ml per minute, and PIN inulin concentration in milligram per 1 ml of plasma. Normal inulin clearance value 125 ml per minute. The creatinine clearance test is used to estimate GFR. GFR is the measure of how well the kidney is working, especially the kidney's filtering unit. The filtering unit are called glomeruli. Creatinine is removed or cleared on the body entirely by the kidney. If kidney function is abnormal, creatinine level increase in the blood because less creatinine is released to the urine. Urine clearance and creatinine clearance are used to measure GFR. Here we see the normal GFR value, decreased renal reserve, mild renal impairment, moderate insufficiency, renal failure, end-stage renal disease, and how GFR level are decreased. Abnormal result, lower than normal creatinine clearance may be indicate kidney problems such as damage to the tubular cell, kidney failure, too little blood flow to the kidney, damage to the filtering unit of the kidney, loss of body fluid, dehydration, such as in dehydration, bladder outlet obstruction, and heart failure. High creatinine clearance value can be caused by carbon monoxide poisoning, hypothyroidism, pregnancy. Urea clearance test. Urea clearance value below 75 is viewed seriously. This may be due to severe renal damage. Tubular function test. Urine concentration test. The ability of the kidney to concentrate urine is a test of tubular function that can be carried out readily without any minor inconvenience to the patient. The test required a water deprivation for 14 hours in healthy individuals. Specific cavity greater than 1.02 indicate normal concentrating power. Specific cavity 1.008 to 1.01 is isoteric. With the plasma indicate no water done by the kidney. This test should not be performed on a dehydrating patient. Urine concentration test. It is used to assess the renal tubular function. The test includes the measurement of specific gravity which depend on the concentration of the solute present in the urine. Normal specific gravity is 1.020. Clinical significance of renal function test is AKI. Here we see the risk category, GFR criteria, and urine output criteria, and how it is measured, how it goes low, and from this criteria we categorize the patient according to risks, injury, failure, loss, or ESA. Now about kidney stone. What is kidney stone? They are generally called renal calculi or nephrolith. They are formed in the kidney from the minerals in the urine. Kidney stone are specifically relieved in the body by passing in the urine stream, and many stones are formed and pass without causing symptoms. If the stone grow to sufficient size, usually at least 3 millimeter or 0.12 inches, they can cause blockage of the ureter. They lead to pain, most commonly beginning in the flank or the lower back, or often radiating to the genital areas. This pain is often called renal colic and typically comes in waves lasting for 20 to 60 minutes. Renal stone or urinary stone are usually classified by their location. If they present in kidney, there is called nephrolithiasis. If they present in the ureter, there is called urolithiasis. If they present in the bladder, there is called cystolithiasis. Slightly more male are affected than women. The type of kidney stone are calcium stone, uric acid stone, steroid stone, and cystic stone. Calcium stone are most common. They can be made of calcium oxalate, most common, phosphate, Vitamin C, spinach containing oxalate, calcium-based kidney stone are more commonly seen in young men between the age group of 20 to 30. Uric acid, this type of kidney stone are common in men than in women. They occur in the people who are suffering for gout or going through chemotherapy. Struvite stone, these stones are found mostly in the women with urinary tract infection. These stones are quite large and cause urinary obstruction. Cystine stones are rare. They occur both men and women who have a genetic disorder, cystinuria. And other medication like dimetrodine and acyclovir can also cause. The causes, various causes of renal stone are dehydration, high protein intake, that is animal protein intake, sodium, refined sugar, fructose, high fructose, corn syrup, oxalate, grapefruit juice, apple juice, increase the risk of renal stone formation. Symptom, blood in the urine, vomiting, nausea, discoloration or foul smelling urine, chills, fever. Renal stone can be diagnosed by abdominal X-ray, ultrasonogram, kidney, MRI of abdomen and kidney, and abdominal CT scan. Treatment, taking 6 to 8 glasses of water per day, increase the urine flow. People who are dehydrated or have severe nausea and vomiting may need IV fluid, and other medication include for pain management, require narcotic medication, in presence of infection, require treatment of antibiotics. Other medication includes albuminol for uric acid stone, diuretics, sodium bicarbonate or sodium citrate, phosphorus solution. Thank you. That is all about